Knock, knock. Hi, my name is Sam. I'll be your student nurse. Today we're going to be performing a head-to-toe assessment. It should only take a few minutes of your time if that's okay.
Yep.
Awesome. Can you verify your name and date of birth?
Yep, Paisley Crawford, 8/23/95.
Okay. I use she, her pronouns. Do you mind verifying your pronouns and any preferred name that you'd like me to call you by?
Yeah, just Paisley and she, her.
Okay. Any cultural considerations I need to be aware of before we begin?
No.
Okay. I'm going to go ahead and wash my hands. I have 3 words that I'm going to ask you to remember and recite back to me at the end of the assessment.
Okay.
The 3 words are going to be cat, apple, and tree.
Okay, cat, apple, tree. Got it.
Okay. What brings you in today?
And just a well check.
Well check. Okay. Are you experiencing any pain today?
No.
Okay. We're going to start by getting some vitals.
Okay.
Your blood pressure is 118/72. Your heart rate is 86. Your respiratory rate is 16.
Okay.
Your temperature is 97.9. Your weight 139, and your height we measured at 5'8". Okay. No pain, vitals. All right, we're gonna go ahead and get started.
Okay.
I'm gonna start with your head. I'm palpating for any lumps or any swelling, and looking at the hair texture, distribution, and growth. All is normal. Can you feel this?
Yes.
Okay. And then looking at your eyes. Your eyebrows and your eyes are both in fair position for your face. Your lacrimal glands, your conjunctiva, and your sclera are both intact. And I'm going to be checking your pupils with my pen light. Can you go ahead and look at this shoulder for me? Okay, and then go ahead and look at my other shoulder. Okay, awesome. And then go ahead and close your eyes for me. And then can you hear this?
Yep.
Okay, and can you hear this?
Yep.
Okay, awesome. Go ahead and open your eyes. I'll have you plug one nostril for me. Can you smell that?
Yes.
Okay.
Oh, sorry.
Can you go ahead and plug your other nostril, and can you smell that?
Yeah.
Okay, awesome. I'll go ahead and have you open your mouth and say ah. Okay, awesome. And then when you stick out your tongue, can you move it side to side for me? Okay, great. I can see your tonsils are in place. Your tongue movement is fair. And then I'm going to have you go ahead and follow my pen light. I'm going to move side to side. And then go in. Okay, great. And then we're going to move down to your neck. I'm going to go ahead and look at your carotids, look for any distension or abnormalities. I'm going to go ahead and auscultate so I can listen to both sides separately, and then I'm going to palpate both sides separately. Okay, and they're both equal on both sides. I'm going to go ahead and have you, I'm going to apply some pressures to your shoulder. Go ahead and shrug for me. Okay, and then I'm going to go ahead and listen to your heart.
Okay.
Now 1, 2, 3, 4, and 5.
Okay.
And then I'm going to listen to your lungs.
Okay.
1, 2, 3, 4, 5, 6. And then can you go ahead and lift up your left arm for me? I'm going to go ahead and listen to the 3rd lobe down there.
Okay.
And then go ahead and lean forward so I can listen to the lungs on your back. 1, 2, 3, 4, 5, and 6. Okay. And then can you go ahead and cough for me? Can you swallow? Okay. I am going to listen to your bowel sounds.
Okay.
And starting from the bottom, 1, 2, 3, and 4. I'm going to do light palpation.
Okay.
Is there any pain here?
No.
Okay. Bowel sounds were heard in all 4 quadrants. Your chest expansion is symmetric on both sides and equal. And the texture of your skin on your abdomen is pink and dry, and there's no swelling or lumps. Okay. Moving to your arms, is there any pain here?
Nope.
Okay, no swelling, no edema, the skin distribution and hair is distributed normally. Your skin on your arms is pink, dry, and warm. And can I borrow your hand?
Yep.
Testing for your capillary refill. Okay. It's responding. Can I go ahead and have your other wrist as well so I can test for your radial pulses?
Okay.
Okay, and they're both equal on both sides. I'm gonna go ahead and have you grab my hands, squeeze them, and then can you pull towards you and push towards me? Okay. I'm gonna go ahead and move down to your legs. And is there any pain with this?
Nope.
Okay. There's no lumps, there's no swelling. Your skin is pink, dry, and warm. The texture is normal. I'm gonna go ahead and test your reflexes on this leg and reflex on that leg. Can you go ahead and roll your ankles for me? Awesome. Can you go ahead and pull towards you and push towards me? And then feeling for your dorsal pedal pulse in the front and your posterior tibial pulse in the back. Okay, I'll have you go ahead and stand up. Can you put your arms out to the side, and then using each finger, can you put it towards your nose? Awesome. Go ahead and put your arms down. Can you go ahead and lift your right leg up, out and to the side and back down, and then your left side up, out and down. Okay, your gait is steady. There's no swaying. Okay, I'll have you go ahead and sit back down. I'm going to have you lean forward, and looking at your spine, there's no protrusions, there's no swelling, and there's no lumps. I'm going to go ahead and percuss. And is there any pain with
Nope.
that? Okay. Okay. I think that concludes our physical assessment today.
Okay.
I am verifying that you are alert and oriented ×4. Your mood presents to be happy. There's no slurring in your speech. Can you recite back those 3 words to me that we reviewed in the beginning?
Car, tree, apple.
Okay, great. And then, do you have any questions for me?
Nope.
Okay. I'm going to give you your call light. Thank you so much for allowing me to perform this head-to-toe assessment on you. I will go ahead and let the doctor know that you're ready and document my findings. If there's any other questions, feel free to use your call light to notify me and let me know.
Thanks
Okay.
so much.
Thank you so much. I'm going to go ahead and wash my hands and exit.